Welcome to the Nonprofit Report, your update on nonprofit organizations, issues, and leaders. I'm your host, Mark Oppenheim, and today we will be discussing epilepsy. November is Epilepsy Awareness Month. I want to honor those who are struggling with this neurological condition, living with it, by focusing on the topic with our very special guests, Ilene Miller, Director of the Rare Epilepsy Network and Director of Epilepsies Actions Network, Beth, Lewin, President and CEO of Cure Epilepsy, and Roy Cherry, CEO of the Epilepsy Center of Northwest Ohio. So thank you all for joining us. I'm so excited about this. Epilepsy has been in my family's life, and it's just great to be talking about this very interesting condition and basically to expand knowledge. Thank you so much.
Well, thank you for having us.
Yeah, it's great to be here.
I'm going to set this up, and I'm going to go over to Ilene first. Epilepsy is one of the most common conditions affecting the brain, according to the CDC. About 5.1 million children and adults in America have a history of epilepsy. About 3.4 million live with active epilepsy, and epilepsy affects all people of all ages, ethnicities, conditions, areas of the country. So, Ilene, let's start off with you in terms of the Rare Epilepsy Network. Let's talk about your views, and then we're going to go around the table. We're going to go to Beth and to Roy about your views of what comprises epilepsy.
Really appreciate your asking that question. And let me just begin by saying thank you for having me today. I'm very pleased to be here to help bring the epilepsies out of the shadows. In addition to serving as the director of the Rare Epilepsy Network and Epilepsies Action Network, I'm first and foremost a caregiver to an adult son who was diagnosed at age 5 with a rare epilepsy. Most people understand that cancer is a universal term for many different types of diagnoses. We know that there's skin and breast and prostate, but people don't understand that the epilepsies are similar. Epilepsy is a global term used to describe a complex of disorders, and those disorders can have many causes. There are genetic epilepsies, both those that you inherit as well as those that happen, for the first time. There's structural epilepsies, those epilepsies where people are born with a brain abnormality, or perhaps they suffer a traumatic brain injury. And there are also epilepsies that are caused by infection or autoimmune disease. And 50% of people that are living with the epilepsies don't know their underlying cause. And we also are seeing an explosion given the proliferation of genetic testing of the genetic epilepsies. And that's really the voice and the lens that I bring today is there are hundreds, if not thousands, of individual rare epilepsies, all under the umbrella of epilepsy.
So it's a descriptive term.
That is exactly
right. Adjective than a noun, if you want to put it in that way. I could be having an epileptic seizure right now, right? Or it could be very dramatic. Right, Beth? I mean, that's the thing. It's not one thing.
It is. And we refer to it as a spectrum disorder because someone may be profoundly impacted, right? And you will know they may be cognitively impacted, developmentally, functionally impacted by their epilepsy. But there are also people who seem very neurotypical. They're able to take their anti-seizure medications, control their seizures, go to school, go to college, get a job, and you may never know that they have epilepsy if they choose not to disclose it. So how epilepsy presents itself is very different across the spectrum.
And Roy, as people age, you also have certain epileptic conditions that actually shift. They change. They can become more or less pronounced. They can change in their character. Isn't that true?
Yes, it is. And, we see that a lot in a lot of the people that we serve or provide resources for in the community. For years, we've done a family camp that provide support for individuals that are affected by epilepsy, and it's across the board. It's from children all the way to adults, and they've been coming to the camp since 1989. So, we're there for them, and we do see the changes in individuals over time and as they age, and sometimes the kids grow out of it, and sometimes they don't, and that's why we're there to support them and provide that resource for them as they go through their life.
So let's talk about kids. We're going to stay with you for a bit, Roy. Let's talk about kids growing up with epilepsy, because it really does have a profound impact on all sorts of different aspects of achieving adulthood. And this idea of being ambushed on a periodic basis by something you can't help, and then being amongst friends and sort of them being the odd one out, being amongst people who won't necessarily be positioned to help you. There's not the understanding. Talk a little bit about that idea of creating community that helps particularly young people deal with the fact that, they might not be all that different within that setting at all. And that in and itself is a healing and nurturing kind of experience to have.
Right. And, our part of our vision is full acceptance and understanding from the community. And that's where we come into play, and going out to, whether it's the schools or places that they work, and educating people about epilepsy and what happens when somebody has a seizure, and how to treat that person afterwards, and treating them with respect, and treating them as just like they're anybody else. And that's one of the things that we really try to get through. And it's hard. It's hard sometimes for especially kids. Kids can be cruel to each other. And, so we get out there, we get out to the schools, we talk to the teachers, we talk to the kids. We have a puppet show that provides education for third and fourth graders, and really just trying to make sure that they understand that, hey, all of us are all equals. And just because somebody has epilepsy and they might have a seizure, that doesn't mean that, they're any different than they were before they had that seizure, and they're still friends. They can still participate in sports. They can still, be involved in all the activities that schools or a childhood does present. So, it's really about educating and getting out there and letting people know what it means to have epilepsy, and not be afraid to admit that you have epilepsy. That's the other thing that we are challenged with a lot is that so many people hide it. And we currently have a board president who has epilepsy. She won our scholarship a couple of years in a row while she was going to college. She's a young lady, and now she's our board president. And she is proud to say that she overcame the epilepsy, and it's part of her. It doesn't control her, but it's just part of who she is.
Let's continue there, because we're going to actually go through the whole issue of care and education and so on, but then we're going to also go into the research here. But we're going to stay with the idea of care and living with epilepsy. Beth, let's talk a little bit about the various experiences that people who live with epilepsy must have in order to keep themselves safe, and as they move through the world. One of the things that I've experienced, for example, is that when colleagues have epilepsy, it's been awfully useful to be told proactively what happens when a particular episode occurs and how I should conduct myself. And then once that happens, or at least in my experience, once that happens, you do what you've been instructed to do, right? You're prepared. You wait until, or you take whatever action is appropriate, and you move on with your day. I mean, then you go to your next meeting with that person, or there might be a little bit of a pause. Beth, how do you and Ilene think about how you equip somebody who has epilepsy to be a bit of an educator and to be a little bit of a self-advocate in this world?
So there are a couple of things there. I think first and foremost, seizure emergency training is really important, helping people understand what you do when you see someone having a seizure. There's this urban myth that, put something in their mouth because they're going to swallow their tongue. That's the worst thing you can do to somebody having a seizure. You don't put anything in their mouth, right? And so there are wonderful organizations in our community, the Epilepsy Foundation and Epilepsy Alliance America, who have these initiatives, and they're out there doing training. You can do it online. They will come into your school or institution and they will train. And it's really relatively simple and easy, but important. So that is one great thing that people can do, is get seizure trained. There's also movement within the community around seizure action plans. And if you have epilepsy, have a plan for how you're going to manage that, right? We have these new amazing rescue medications that you can take intranasally, just a little squirt up the nose. And there's even in development one that you'll be able to inhale. So it makes it very convenient for people if they're in an office or in a school to access this rescue medication. And like you said, right, treat the seizure, stop it, and move on with their day. That does require, right, that you let people know that you have epilepsy, because you'll need somebody to assist you. And that's, I think, where the stigma and the other pieces come in, is people have to be comfortable letting those around them know so that they can help them in the time of emergency.
Ilene, you want to add to that?
Yeah, I would just echo what Beth has said. I think it's as easy as the 3 S's. So folks can remember: stay safe side. And that's the best way that you can care for somebody who's having a seizure. You want to stay with them, reassure them, make sure that they're in a safe place. And you can roll them over to their side. You can put something soft under their head. And the same way that, we encourage people to be CPR trained, to be aware when somebody has allergies and they might have need for an EpiPen or aspirin after a stroke. The same is true for epilepsies. If you see somebody's wearing a medical bracelet, they may very well be carrying that rescue medicine that Beth described. And it's meant that anyone off the street can administer it. So we encourage everyone watching this video, please go get epilepsy trained. You can do it quickly and efficiently, and you can really, truly save a life. The other thing I'd like to just acknowledge is that people think of seizures as sort of one size fits all. And typically they're the seizure that you've seen, maybe in the movies or on TV with somebody on the ground and, they're sort of moving in place. My son had what's called absence seizures. Those are staring seizures. He also had gelastic seizures. Those are laughing seizures. So it wouldn't be obvious to the average passerby that my son was in fact having a seizure. So as important as it is to understand that there are many types of epilepsy, there are also many different types of seizure. And I think by people having that awareness, they may be able to help somebody. And lastly, I'm just, again, wearing my Rare Epilepsy Network hat. We're talking about people that are sort of out in the world that can advocate for themselves, that can carry rescue medicine. But I just want to acknowledge that there are a large number of people, and Beth referred to them earlier, who are at the other end of the spectrum, who are really dependent on caregivers for their care. They tend to be the most complex, having the most seizures. And so, when you see those families with those children or loved ones, even adults, reach out to them, befriend them. These families are experiencing tremendous hardship in the care of their loved ones, and they're looking for community support and acceptance as well.
One of the things that really bothers me about what I experience in this country is the fact that having means treatment, and not having means often not getting treatment. Having means education, not having means not having education. It's a real problem, because the people who are best positioned in society to have their conditions addressed is a very small portion of the total of our population. How do we deal with that issue when it comes to epilepsy? Because we have some wonderful medications now. We have some treatments. There will be more, but it's all driven by money. How do we equalize the playing field? Because just because I grew up in a family with less means, or I have less education, doesn't mean that I should not have treatment, Roy. How do we deal with this?
Yeah, I mean that's what we're here for here in Northwest Ohio is that we fundraise for all the stuff that we do for people, and it's free for anybody to attend our camp, for us to come in and do the education. We even do a medication assistance program. We will pay for medication, anti-seizure medications, if for whatever reason their insurance hasn't picked it up yet and they're running out of their medications, and we will pay for their medications to kind of bridge that gap so they don't get off those medications. Because as we all know, if you're on anti-seizure meds and for whatever reason you come off of those, you could have a breakthrough seizure and you kind of have to start that whole process over again. And one of the things that Beth had mentioned, which I think is awesome, is the new rescue meds that are coming out that are nasal sprays. So much better than, let's say, the diastats that were out there. That gives the person much more dignity than having to deal with doing some of the other rescue medications. And whether it's a young person in school or somebody at work, those rescue meds that are the nasal sprays I think are phenomenal. And we had a presentation earlier, and the efficacy of it is, just the same. And so I really hope and pray that we see a lot more of people going to that type of medication as this comes out.
Are you finding that there is cooperation, all of you, with the drug and medical device companies in terms of ensuring that there is access to people of lesser means to their product? Or is it more like that's your problem, you nonprofits, you government folks? Are you finding those partnerships, Beth?
Yeah, the industry partners within the epilepsy space are really, really pretty good. Most of them have patient access programs, so it depends on your financial situation, but they are in many instances able to help provide you with free drug if your doctor feels that's the medicine you need and you don't have the financial means or insurance to get it. They are also very supportive of all of us in the epilepsy community in doing education and materials and all kinds of ways. So in my opinion, they're really good partners in this journey as we work towards finding cures.
Ilene, are you finding the same?
Yeah, I would say the same thing. And I just want to mention that there's an association, it's called the National Association of Epilepsy Centers, or NAEC. And that's a group of about 250 epilepsy centers all across the country. And they're level 3 and 4 are the highest. So for anybody that's been diagnosed, no matter what your means, ask your doctor if your seizures are refractory, if they're not responding to medication intervention, for a referral to an epilepsy center. Many of them have programs where they will, see you either virtually or in person. You can get a second opinion there, but it will give you access to all of the different interventions. And that includes, medicine, diet, surgery, as well as devices. And so to try to bridge that gap and ensure that people are getting access to what we know are the best practices for these different diagnoses, as well as making sure that people are getting a precise diagnosis so they can get the precise care. And that sort of harkens back to the cancer example. You wouldn't treat somebody with skin cancer with a breast cancer intervention, and the epilepsies are true. Understanding that specific cause of epilepsy will lead you down a pathway for a precision intervention that will have better outcomes for the person in the long run.
So, Ilene, let's stay with you. We're going to go Ilene, then Roy, and I'd love Beth to comment on the question of research into both treatments and cures. It's interesting because you have a whole series of branches in terms of how epilepsy manifests and therefore how it should be addressed in terms of treatment. And then you also have to go back up through the actual causes. You go through those branches up to the actual causes, and there might be interconnectedness between certain clusters of epilepsy. So, Ilene, could you talk a little bit about the state of the art as you see it, Roy, and then Beth at Cure Epilepsy, how this research is progressing and what needs to take place in order to fast forward research both on the cure side and on the treatment side?
Well, I will definitely start by saying that the epilepsies are underfunded given their impact. And so we definitely need more investment from the federal government, as well as from the private sector, and from nonprofits who are already working tirelessly to encourage research across the epilepsies. I think one of the most exciting things that's happening, and frankly, it's underutilized in the epilepsies now, is this rapid genome sequencing. So we're taking both infants as well as adults. And through this advanced genetic testing, we can get down, in many cases, to a very precise diagnosis. And that starts them on the pathway or the journey towards getting the precise care that they need. Not only does it enable better care, which means that we're hopefully preventing the damage that the seizures can do over time, but it can also help inform the caregivers on family planning, on what to expect in the future, and also to help those persons find their community. If I know, for example, that my son has a disorder, a hypothalamic hamartoma, and there's an organization that serves that disease, like Hope for Hypothalamic Hamartoma, I can be in the company of others that have the information, the experience, the education, the access to research and clinical trials that are trying to learn more about that disease. And that's critical, especially as we understand the epilepsy as being a complexity of many disorders. So I will say again, people should be armed to ask for genetic testing if they are newly diagnosed with epilepsy to get to that precise diagnosis. And that will help feed their understanding as well as research.
It's interesting. When I was at Oracle Corporation, we had a project in which we were trying to take a look at medical records and then genomic sequencing and try to create correlations. And so this is downstream. So that was 20, 25 years ago. So this is downstream from that. And then when I did searches for the TGen Foundation, Translational Genomics, they were also trying to trace through the genetic sequences that led to certain conditions. And that's what you're referencing, Ilene. It's now being fast forwarded, being aided by big data and the tools that we have, artificial intelligence, being able to reverse that data. Roy, what are you seeing in terms of research trends and how it's impacting you and your folks?
Well, what's interesting is Ilene, and I'll probably ask her actually more questions, is I was sitting in a doctor's office and there was a magazine on the table and it was about neurological stuff. And I read the study about what I think Ilene is talking about, the recent, where they are geotesting like this early on in infants, right? And they can discover some things about what type of epilepsy it might actually be and how to treat that so much earlier than waiting for a person to have the seizure and then going through those testing. So, I mean, that is really kind of what that study did, right? I mean, they were testing the infants early on, and it can help identify it early on. Is that kind of what I read?
Yeah, that's exactly right. In my son's instance, it was 5 years and 5 years of seizing to diagnosis. And now that diagnostic odyssey, which still exists for some, is being cut down dramatically. I mean, literally from decades, years, months to weeks. And that's what we need, because as we say, time is brain, right? And so the longer the brain is seizing, the worse sort of the long-term symptoms are going to be, the sooner we can invite some of those new therapies and interventions, the more we are preserving that brain where we can. I will mention, though, that unfortunately 1/3 of our patient population is refractory. So we don't have all the tools that we need in our toolbox to treat people with the epilepsies.
I'm just glad I picked that magazine up instead of the People magazine.
Yeah.
Well, this is the thing that I love about this, is that we all have knowledge that the others don't possess, no matter what corner of the country you are. And I can't tell you how often I'm in these discussions and we have somebody from, and it doesn't really matter. It could be an intense urban area, a rural area that is distant from any major towns, and all of a sudden we're sharing knowledge like we're doing here, Roy. That we just, it's not part of our daily interactions, and by interacting we're actually conveying valuable information to the other. Beth, Talk a little bit about how you see the whole fight for a cure and where the research threads are going and where you see the trends.
Yeah, this is the 25th anniversary of Cure Epilepsy. So we've had a chance this year to kind of look backwards to see where we were and the progress we've made. And it's a really, really exciting time in epilepsy research. I would say starting with our ability to monitor seizures, right? We've got much better EEG technology, stereo EEG, putting implants in the brain to really pinpoint where seizures are coming from, so that we can potentially determine that more people are eligible for surgery. We're able to detect micro seizures. So the diagnosis is improving substantially, and then there's just a plethora of really cool stuff going on research-wise, disease-modifying therapies to potentially cure epilepsy. So things like antisense nucleotides that replace or restore RNA is really cool. There's this company called Neurona that's a biotech, and they are in a clinical trial. They've got 3 patients in, I think, looking at regenerative stem cell therapy, right? Very cool. Lots of gene therapy, lots of big data. We have all these great databases with natural history or genetic data that is begging to be mined to find answers, and there's the short game and the long game, right? And we're really kind of focused on the long game. We want the cures, but until those cures come, stopping seizures is really important. Every seizure does damage. So if we get more therapies or surgical interventions and ablations and ultrasound, things that can stop seizures in the short term till we get to that disease modifying stuff at the end. Those are all really good things. So there's just a lot happening that gives you hope that it's on the horizon. We're getting closer.
And this is one of the great things about the American system, right? We have government, university-led, industry-led, nonprofit, private citizens, these different approaches to treat, to discover, to share knowledge, and every patient is a resource, right? Every patient has something to share that can help to advance toward a cure and toward treatment. Ilene, before the show, you talked a little bit about off camera about the bipartisan epilepsy caucus. Could you give us a little bit of detail about what's going on November 14th and how the various interests in Congress are actually going to come together around a topic? Isn't that a great thing? But epilepsy affects everyone, including the families of members of Congress. So talk a little bit about what's going to transpire and who's going to participate.
That is exactly right. And we are so lucky that we have a bipartisan epilepsy caucus. It's led by Representatives Murphy and Costa, each who have personal experiences with the epilepsies. And they are convening a briefing where we'll bring clinician researchers, advocates, caregivers, as well as people who have suffered losses from epilepsies together to talk about how this disease impacts everybody. Like you've said, everybody from newborns to adults, all ages. It really does not differentiate among people. And we'll hear from these folks about the urgent need for more resources for the epilepsies and what our legislators can do. And if folks are watching this, and they can go to the epilepsycaucus.org website, check to see if their members are part of that caucus. And if they're not, we hope that they will encourage them to join. If you, as a constituent, have been touched by epilepsies, you should encourage your House of Representative member to stand in solidarity with other legislators for the epilepsies.
Thank you so much for sharing your knowledge with us. Please thank your people, your donors, your supporters, your patients, and your partners, because you're all part of this cure, this attempt to improve treatments. And we're so appreciative. It's so important for so many people across the world and across this country. Thank you.